Hello, and welcome to Seasoned and Bold. Did you know that your skin, your nails, even your breath, could be revealing hidden clues about the health of your liver? Liver disease is far more common than most people realize, and often, the liver sends desperate signals for help long before we notice. Today, we're going to expose the common myth that your liver is a silent organ. It's not silent, it's screaming. And I'm going to show you the top signs of liver distress that you can spot, what's really causing them, and crucially, how you can transform your liver health and prevent serious, irreversible damage. The unsung hero. Your liver's incredible power and vulnerability. First, let's talk about this wondrous organ. Your liver is a large, powerful organ, weighing about 3 pounds, located just below your diaphragm in your upper right abdomen. It performs over 500 essential functions every single day. Think of it as your body's natural filter, converting nutrients from your diet, cleaning toxins from your blood, breaking down fats, alcohol, and medications, controlling blood sugar and hormone levels, and even storing iron. It even plays a critical role in your immune system, with specific cells that can destroy viruses, bacteria, and other harmful organisms. Your liver has an amazing capacity to regenerate itself after damage. It can even regrow to a normal size after up to 90% of it has been removed. But here's the crucial part. The liver isn't invincible. While it's well equipped for its job as a filter, constantly working overtime to restore itself takes its toll, and eventually, it can't keep up. The visible warning signs. What your body is telling you. So, how do you know if your liver is struggling? Often, in early stages, chronic liver disease won't cause obvious symptoms. But as liver function declines, your body starts to show more noticeable signs. Let's look at what to watch out for, starting with your nails. Muehrcke's lines. These are horizontal white lines running across the nail, actually on the tissue underneath, and they temporarily disappear if you apply pressure. They're linked to low levels of albumin, an important protein produced by the liver, which is often low in liver disease. Terry's nails. Noticeably pale nails, often with a normal pink half-moon, lunula, at the base. This paleness is due to changes in the tissue underneath the nail, making it difficult to see tiny blood vessels. Also linked to low albumin. Nail clubbing. If your fingertips appear enlarged and your nails curve around them, with no diamond-shaped gap when you put your nails together, this is clubbing. While it can be genetic, it can also signal issues with your heart, lungs, or liver. Now, let's move to your skin and other visible areas. Caput medusae. Take a look at the belly. If you see a striking pattern of swollen, twisting veins around the belly button, this is a sign of severe liver issues. It's caused by portal hypertension, where scar tissue in the liver blocks blood flow, forcing blood to reroute through smaller, visible veins. Ascites. This is a very distended abdomen filled with fluid. Upwards of 15 liters of fluid can leak into the abdominal cavity due to increased pressure in the portal vein. It's incredibly uncomfortable and can make breathing difficult. Palmar erythema. Notice red palms, especially affecting the areas over the thumb and pinky mounds, sparing the center. This can be caused by liver disease and is linked to high estrogen levels, which the liver normally breaks down. Spider nevi. These are spider-like shapes of dilated blood vessels on the skin. Having 3 or more can indicate high estrogen levels and potential liver disease. If you press on them, the blood will temporarily disappear. Jaundice. A yellow tint to your skin or the whites of your eyes. This happens because your liver isn't properly processing and eliminating bilirubin, a yellow substance from red blood cell breakdown, which then builds up in your blood. Your urine might even turn a dark yellow or brown, like tea. Easy bruising or bleeding. If you're bruising a lot, or bruises are large and take a long time to heal, it's a concerning sign. Your liver produces clotting factors, and in liver disease, these levels decrease. The liver also makes thrombopoietin, a hormone that tells bone marrow to make platelets, so less hormone means fewer platelets, making it harder to stop bleeding. Muscle wasting. This can be subtle, but visible around the temples or in the palm of your hand. When your liver is damaged, it can't process nutrients, make proteins, or store energy properly, so your body starts breaking down muscle for fuel instead. Asterixis. Flapping hand tremor. This involuntary tremor, seen when holding your arms out straight with extended wrists and fingers, shows an interesting link between the liver and brain. It's due to ammonia buildup in the blood, a toxin normally cleared by the liver, affecting the brain in a condition called hepatic encephalopathy. Fetor hepaticus, a distinct, musty, sweet smell on the breath. This is caused by toxins like dimethyl sulfide that build up in the blood and get breathed out. If you notice any of these signs, especially multiple ones, it's a strong signal to talk to your doctor. The hidden dangers. Understanding risk factors and progression. The troubling reality is that many types of liver disease won't cause symptoms in the early stages, but it progresses through stages. 1. Hepatitis. Inflammation in your liver tissues. 2. Fibrosis. Gradual stiffening from scar tissue. 3. Cirrhosis. Severe, permanent scarring where the damage is no longer reversible. 4. Liver failure. Your liver can no longer function adequately, often fatal without a transplant. The good news is that some amount of fibrosis is reversible if the damage slows down enough for the liver to recover. This highlights why early recognition and action are so crucial. So, what are the primary risk factors for liver disease? Excess alcohol consumption. Alcoholic fatty liver, hepatitis, and cirrhosis can begin with as little as 4 drinks a day for men and 2 for women. Long-term abuse can lead to liver scarring and cancer. Obesity, diabetes, or high cholesterol. These conditions can cause non-alcoholic fatty liver disease, NAFLD, the world's fastest-growing reason for needing a liver transplant. It's essentially excess fat stored in your liver. Studies show 30–45% of Americans carry excess fat in their liver. Viral hepatitis, B and C. These chronic infections are a leading cause of liver disease and liver cancer worldwide. Hepatitis B can be transmitted via blood, sexual fluids, or at birth. Hepatitis C is blood to blood. Exposure to toxins. While your liver cleanses toxins, overexposure can be harmful. This includes chemicals in cleaning products, aerosol products, insecticides, and even certain natural herbs and supplements. In fact, 20% of liver injury in the US is caused by herbs. Unsafe practices. Using dirty needles for drugs, tattoos, or piercings. Unprotected sex with many partners increases the risk of hepatitis B and C. Certain medications. Taking too much of even common over-the-counter medications like acetaminophen or ibuprofen can damage your liver. Mixing alcohol and medicines is also highly dangerous. Inherited conditions. A family history of genetic liver diseases like hemochromatosis or Wilson disease can increase your vulnerability. It's vital to recognize that these factors often combine to overwhelm your liver's regenerative powers. Transform your health. Actionable steps for liver prevention. The great news is that preventing liver disease is possible with simple lifestyle changes. There's really no cure for end-stage liver disease aside from a transplant, so prevention is key. Here's what you can do. Eat a balanced, liver-friendly diet. Hollow Bullet focus on the Mediterranean diet, rich in fruits and vegetables, especially brightly colored ones, whole grains, beans, legumes, and healthy fats like extra virgin olive oil, nuts, and seeds. Hollow Bullet limits saturated fat, sugar, and processed foods like sugary drinks, chips, cakes, and takeaways. Hollow Bullet drinks 6 to 8 glasses of water a day. Hollow Bullet wash fruits and vegetables to remove pesticides. Exercise regularly and maintain a healthy weight. Hollow Bullet being overweight or obese is a major cause of fatty liver disease. Hollow Bullet even a small amount of weight loss can make a big difference. Hollow Bullet aim for at least 150 minutes per week of blood pumping exercise. This helps reduce liver fat and detoxes your liver. Limit alcohol intake. Hollow Bullet while it's best to avoid alcohol altogether if you have a liver condition, otherwise, drink in moderation. No more than 2 alcoholic drinks daily for men and 1 for women. Hollow Bullet recognize that even moderate drinking can contribute to liver damage over time. Avoid toxins and harmful substances. Hollow Bullet be mindful of chemicals in cleaning products, aerosols, and insecticides. Use them in well-ventilated areas and wear a mask if needed. Hollow Bullet don't smoke, it's harmful to the liver. Hollow bullet. Avoid chronic use or misuse of illicit drugs and be cautious with prescription drugs. Hollow bullet. Never mix alcohol and medications if the label advises against it. Practice good hygiene and safe habits. Hollow bullet. Wash your hands regularly with soap and warm water, especially after using the bathroom or handling food, to prevent the spread of hepatitis A. Hollow bullet. Practice safe sex to reduce the risk of hepatitis B and C. Hollow bullet. Avoid dirty needles for any purpose, including tattoos and body piercings. Hollow bullet. Don't share personal hygiene items like razors or nail clippers. Get vaccinated. There are safe and effective vaccines available to prevent hepatitis A and B. Regular health checkups. Hollow bullet. Since early liver disease often has no symptoms, ask your GP for a liver health check as part of your annual physical. This includes identifying risk factors, body measurements, a liver scan, like a fibroscan or ultrasound, and a blood test to check liver function. Be skeptical of liver supplements. While some studies show very limited benefits for people with liver disease, there's not enough evidence that supplements like milk thistle, artichoke leaf, or dandelion root detoxify or protect the liver in otherwise healthy people. Some can even be harmful, especially if you mix them with other medications. Always consult your doctor before taking any supplement. Your body's amazing. It's easy to live as if your body will always be healthy, but simple, everyday lifestyle choices could cause a lifetime of heartache if you end up with liver disease. Your liver is truly a vital organ, performing hundreds of functions to keep you healthy. It's not a silent organ, it gives you warnings. Understanding these signs, recognizing the risks, and making proactive lifestyle changes can make all the difference. Prevention is truly the best medicine when it comes to liver health. Don't wait for symptoms to appear. Take charge of your liver health today. Talk to your doctor if you have concerns, or if you want to get a liver health check. If you found this information helpful, please give this video a thumbs up, share it with a friend who might benefit, and subscribe to our channel for more insights into your health. Stay curious, stay healthy, and I'll see you in the next video.